I hope that the contouring went well for you. I want to show you where we are compared to where we started. So I have a model of the pre-op and then where we are currently. So you'll notice that we've closed the anterior open bite. As we look from the proximal, you can still see there's some overjet, but now we have appropriate overbite. But we're going to be opening on the lower. But when we open on the lower, we're going to be adding length to the incisal edges, and we're going to be adding cusp tip height. So we have to do that because if you imagine that we were just to go ahead and add proper height to these lower anteriors, then we're going to be into a situation where we're going to have just occlusion on the anteriors and there'll be a posterior open bite. So this is a technique that I use commonly when I'm doing veneering of the lower anteriors with these worn teeth. I prefer not to have to prepare the edges of these lower teeth because they've already worn down enough. And as you know, as we're working on lower anterior teeth, they're hard teeth to prep. They're difficult because they're so small. So if I can minimize how much preparation I need to do, especially on the incisal, I think that's super helpful. It's going to help maintain as much enamel as we can. What I've also found with these patients with this wear and erosion, they've also lost some of the facial contour to the tooth. So many of these lower incisors, there's very minimal prep involved, especially if we're able to open up the vertical dimension and set the incisal edges at a new ideal position.